everyone. Welcome back to UBC TV Health Facts program. My name is Chirabo Caleb Chimeze. As usual, we're always back with issues concerning our health. Now, as we know, since 2011, that was October on 25th, there was something that was birthed in Uganda, and we started commemorating or remembering or celebrating or talking about or creating awareness about Spina Bifida and hydrocephalus. And today we're going to be discussing more about Spina Bifida and hydrocephalus. And with me in the studios, I have a gentleman, yes, who is going to be taking us a lot. He's going to create more awareness, help us know what Spina Bifida, hydrocephalus, and how are they caused, how can we prevent them. You know, we're going to learn more from him. Sir, you're most welcome.
Thank you very much, Mr. Moderator.
Oh, wow.
Hello, good morning, viewers. My name is Isaac from Spina Bifida and Hydrocephalus Association of Uganda. I'd like to reach out to you today.
Yes. You look so smart.
Oh, thank you. You're smart too.
Thank you.
Yes.
You've talked about Spina Bifida, hydrocephalus. These look like medical jargons. What are they in the simplest language?
Yes. Medical jargon has never had a simpler language than the best we can offer today.
True.
To try and just describe what these two conditions are. To make it brief, Spina Bifida is a birth defect that babies are born with. Precisely, this comes as a result of incomplete formation or development of the backbones, and therefore the baby will be born with either open wound on the back or kind of a swelling on the backbones, and that is what we refer to as Spina Bifida.
Wow.
It's a medical jargon combining trying to describe a split back.
A split back.
Yes.
Well, I like it. I think that is Spina Bifida seems to be a Latin word.
It is Greece.
It is Greece.
Yes.
Okay.
In Greek, something split, they call it bifida.
Okay.
And then, spina is now the backbone.
The backbone.
Yes. Yeah. So spina bifida is a split of the backbone, and that's why I've described it as it's in now English term. It refers to open back, where one of the backbone failed to close normally. Yeah. And this usually happen within the first trimester. And to be precise, within the first 21 days of formation of the embryo.
Okay.
When the baby is just developing in the mother's womb.
Okay.
And when something goes wrong, it leads to one or more of the backbones failing to complete normally. Okay. And this now will be characterized by, the spinal cord, which is a continuation of the brain that runs down our back. Okay. So the spinal cords and its covering may fail now to develop normally, and they protrude or they swell out of the spinal canal.
Okay.
That opening within the backbones.
Wow,
yes.
I think that is a good explanation.
Sure.
Well, looking at the association you came from, that is a Spina Bifida Hydrocephalus Association Uganda.
Yes.
Somewhere you mentioned hydrocephalus. What is hydrocephalus?
Oh yes, hydrocephalus, in a simple way we can call it water within the brain. Normally, every human being, a living animal, has some water which is produced within the brain. And in medical terms, this is referred to as cerebrospinal fluid. It is produced for the purpose to protect the brain, to nourish the brain.
True.
And this water really has to flow and exit the brain, and its circulation continues as normal. That is why me and you, we are not having any difficulties. But in an event that the exit route or the path through which this CSF, the cerebrospinal fluid, is supposed to be drained off the brain, in an event that either it is narrowed or something happened and it is blocked completely, or the path is not created well during the formation of the baby in the womb, this fluid will accumulate within the brain ventricles. Within the brain, we have some pocket-like structures within the brain, which is supposed to contain this water and balance its flow. And in an event that this flow is not being drained normally, its accumulation within the brain, it will generate pressure which is not necessary, and this pressure will lead to expansion of the head size, and we can visibly see that the child is born with abnormally bigger size of the head. Okay. If this pressure is not regulated, is not controlled, the head keeps on expanding.
Wow.
And that can lead even to death, can lead to damages to the brain tissues, which at the end of it all, the child will be having a lot of difficulties or will present with varied form of disabilities.
Wow, it seems it comes with a lot of complications. The way you explained hydrocephalus, I was trying to create a picture in my head, especially me, a non-medic. I'm thinking maybe inside our head we have a pool of water, something like a swimming pool, and we have a tap where water is drained. Well, we are living in a country such as Uganda where we have a lot of culture and taboos. And people have different perceptions on the diseases. You know, you talked about hydrocephalus, water in the head, and you talked about spina bifida, talking about incomplete closure of the spine. What do you think people perceive these diseases to be, in actual sense, the myth?
Generally, you're right, Mr. In general term, all birth defects, our community or local population consider it something strange. Indeed, it is not a normal occurrences.
True.
And when people see it, they respond to it in unique ways, which is pre-informed by their thoughts and their cultures. In different communities in Uganda, people refer to these birth defects in different ways. But literally, they have lack of information about this defect. That's why they refer to it in the way they mean. Sure. In most cases, they believe it is misfortune. They believe it's a curse. Others believe it is a witchcraft. It's a result of witchcraft. In some communities, they believe it is as a result of sacrifice. If a family has made a sacrifice to God, and as opposed to European countries, in Uganda, people believe it is a disease of the rich people.
The rich people.
And yet the Western world believe it is the disease of the poor. So in Uganda, they believe it's the disease of the rich people in the context that a rich man made a sacrifice to get the wealth that he has accumulated. True. And therefore, that demigod is demanding for, But that is not true. I love the fact you put it that it's myth. It's some belief that runs different cultures, which is not true about this. But the fact is, these are birth defects that comes from as a result of different, happenings. For instance, during formation of the baby in the womb, there are needs of, some critical elements that are needed. For instance, folic acid,
true.
Vitamin B, irons. All these elements play a critical role in the complete formation of neurotube, which at the end of it all, it results in the formation of the brain, the spinal cord, and its different parts.
Yes, still at that point of the myth, in Uganda, we have a saying that says that the one who has not moved will always believe his or her mom is the best cook. So those who have been in a certain region, they have quoted or they have defined certain illnesses the same way you've explained. Before we came to air, we were discussing, and some people perceive it as having sex in the cassava garden. Well, having looked at that, well, you see, looking at the statistics in Uganda, they say about 600 to 800 people annually are affected with spina bifida, and about 3,600 to 5,400 people are affected with hydrocephalus. What do you have to say about that?
Well, thank you for that observation. I would say the statistics in Uganda is not precise, because if we go by global prevalence, it's stated that it varies among the populations and different nations in the rate of, for spina bifida, at least 0.5 to 1 in 1,000 live birth will be born with a defect of spina bifida.
Okay.
And hydrocephalus, about 1 to 5 in 1,000 live birth will be born with hydrocephalus. And in the least developed countries, where the health services pay least attention to such birth defects, the prevalence is much higher than in other developed countries. For example, in the US, there's been no incident of post-infectious hydrocephalus or acquired hydrocephalus which has been recorded or reported on.
True.
But in Uganda, most of the cases, way beyond 50% of the cases of hydrocephalus being treated in different hospitals are as a result of either infection, that means the baby was born normal,
True.
and then something happened in between, and either baby acquired infection which was not managed well in time. The incidence of premature deliveries contributed significantly to infants acquiring this defect. So the incidence varies from place to place. But in Uganda, at least 2 to 5
2 to 5.
children will acquire hydrocephalus.
The
in a
truth
terminal
is,
advance,
you are a brilliant person. I thought statistics you'll be off, but both medicine and statistics you're just God. Well, having looked at that, we are talking about spina bifida, we are talking about hydrocephalus. Well, what causes these things?
Well, I think we need to look at these two conditions. Even when they both affect the central nervous system, let's look at them independently.
Independently.
Precisely, like I stated when I was trying to describe what spina bifida is.
True.
But this is a birth defect that a baby is born with. Meaning, if a child is delivered without that defect along the backbone, the child will never get it. So I would prefer to talk about them separately.
True.
One, spina bifida, it's grossly attributed to deficiency or lack of folic acid in the bloodstream of the mother at the time of conception. The reason I'm saying at the time of conception, because the core structures of the neurotube forms within the first 21 days.
True, true.
A period during which even our ladies are not aware that they're pregnant. So if the mother is lacking adequate folic acid in her bloodstream at that time of critical formation of the baby, a malformation of the backbone is bound to happen. So that is the only known cause that is known, and it contributes to about 70%. Because the research has proved that where there is adequate use of folic acid before pregnancy among the population, the incidence is reduced by 70%.
70%.
So we can state precisely that folic acid contribute to 70% cause of that birth defect.
Well, quoting what you just said,
Yes.
you just say that lack of enough folic acid in maybe, let's say, at this time we could be looking at a pregnant mother,
Yes.
because we are bringing a new life to earth.
Sure.
You say that lack of enough of it, especially in the first 21 days of conception, it leads to about 70% causes of birth defects.
Yes.
That is true.
True.
What is folic acid you're talking about?
Folic acid is a vitamin. Literally, it's a combination of vitamin B9.
B9.
Yes.
Okay.
And we can get it from the food, surprisingly.
Oh.
Got from the food that we eat. The folics, the richly green vegetable and the citruses, the fruits, the red beans, and some of the animal products. Yeah, we get it from the food we eat. And also, I talked about 70%. Other causes are attributed to environmental factors, nutritional factors, because the evidence has also shown that preconception obesity also contributes to the malformation of, or to the birth defects.
Do you mean people should hit gym when they're pregnant?
Not necessarily hitting gym when you're pregnant, but the preparation of when do you want to become pregnant.
Okay.
And then generally our nutritional and our lifestyles. How do we eat? How do we feed? How do we take care of our health, nutrition-wise? Because obesity is something that cannot be controlled within the first 21 days of pregnancy.
I know.
It takes time for you to reduce your weight.
I know.
And therefore, it's prudent that you take precautions on what you feed on. It's more advisable to feed on more vitamin-rich foodstuff other than eating a lot of carbohydrates and protein in that manner. But our community should adopt, good nutritional practices so that we can take care of our health nutritional-wise. Because it grossly contributes to birth defect as well, yes.
I think the management should always invite you here to talk more about nutrition.
I would have loved to have more time to talk about nutrition, yes.
Well, people believe outside there in our communities that even when you're not feeding on the vitamins or carbohydrates or what, but just giving yourself a peace of mind, they say that it's also one of the causes of obesity, in quotes.
Exactly.
Mental
health contributes grossly to our physical health as well.
Okay.
So if you don't have a peace of mind, you're bound to have varied form of mental illnesses,
okay,
of which disorder in the feeding habit is one of the main form of mental illnesses.
Mental illnesses.
So, so it is advisable to have a peace of mind.
A peace of mind.
Less precisely, yeah.
Well, going back to the causes of spina bifida as per now, you've so far explained broadly about 2 factors. Any other?
There's also been evidence of at least a risk of 5% risk of this birth defect reoccurring in the lineage, in the same family.
Okay.
But that does not confirm whether it's a genetic disorder in the family.
Okay.
there's no evidence of this condition running in a family, but there's a risk of 5% of a mother who has produced a child with spina bifida, or a child who has spina bifida, to produce another child with spina bifida.
Spina bifida.
Yes.
So,
And that means that we need to take extra precautions. Once the child has been delivered in a family with spina bifida, we need to take precautions. And this precaution is taking folic acid for lifetime.
For lifetime.
The lifetime here I'm referring to the period within which a mother is viable, sexually viable, within which, precisely the period within which the ladies are within the age of a childbearing age.
Okay.
Yeah.
Okay. Still at that point, highlighting the fact of genetic predispositions and the family history. Somehow in my mind, I'm thinking that if in one family, maybe the wife has, let's say, spina bifida, and the husband doesn't have, chances are high that they're likely to give birth to children with spina bifida. Or in the family where a couple, parents, give birth to one child with spina bifida, is it more likely that also their children will give birth to children with spina bifida?
The study is still trying to analyze why the risk of 5% that I've talked about.
Okay.
So at the moment, the only available literature talks about the 5% risk of a mother who has produced a child with spina bifida to get another child with spina bifida.
Okay.
But the fact whether it is a genetical factor, there's no evidence that substantiates that fact.
Okay. We've heard more about spina bifida, hydrocephalus now. What do you think causes hydrocephalus?
Well, hydrocephalus, like I described, that either a child may be born with it when the head is excessively big, or the open lines in front of, on top of the head. You see, usually I believe if you've ever seen a newborn, there's an opening on top of the head, which is palpable. When the child is breathing, you also see it palpating, it plays.
Fontanelles?
Fontanelles.
Okay.
I don't have a better English to describe it, but those are the lines of openings where the different bones of the head meets.
Okay.
When a child is born with water already accumulating within the brain, we see that the head is either already big or that opening is larger than the normal size.
Okay.
That is one. Two, a child can be born normal. With the normal size of it, everything is okay. And acquired infection, acquired is hydrocephalus, like we have described. So that means there are broadly two categories.
Okay.
A congenital form of hydrocephalus, which the causes are still greatly attributed to deficiency of micronutrients during the formation of the child in the mother's womb, which we've talked about micronutrients. And in this case, we're talking about folic acid and the ions.
Okay.
I would be more interested to talk about why a child born normal acquire hydrocephalus.
That is the acquired
hydrocephalus, yes. Okay. Because the child was born without it.
A bouncing baby, moreover.
Bouncing baby, a healthy baby, but few weeks after birth, you see the head start, excessively growing larger.
Maybe before you give us that, you talked about a large head. People may start getting worried. Some people have small heads, some people have big heads.
Sure.
What is the standard, size of the circumference of a normal head? The average.
The average.
Yeah.
We need to appreciate the fact that God created us differently among different races. For example, there are certain people naturally, they're blessed with very big heads.
Wow, they are blessed.
It's big heads, and you cannot compare the size of the head by mere looking at it.
True.
But I will talk about our context in Uganda. Average size of the head of a baby, it ranges between 30 to 35% if you take the head circumference.
Quite small, quite big?
It's average. That is normal.
Wow.
And there are incidences where babies are delivered with excessively small head, microcephaly. It's a topic for another day. So today we are talking about excessively bigger head.
True.
In terms of size of the head, we cannot diagnose or cannot say this one has hydrocephalus or not.
Looking at the
matters,
head just.
It's not just by mere fact of looking at the head, but what matters is the amount of pressure within the head, the amount of pressure within the brain.
The brain.
For that fact. It is the pressure that defines whether someone has hydrocephalus or not. If the pressure is significantly impairing the normal functioning of the baby, that's what worries. And the treatment we look at, as we shall look at it later, we'll look at only arresting this pressure or
pressure.
controlling this pressure
Okay.
so that it gets back to normal. And we are able to function, and the baby is able to function and thrive well.
Okay.
Yeah. Now, getting back to
Acquired.
the acquired hydrocephalus.
Yes.
I said babies can be born normal,
Okay.
and then something happens in between. And what is significantly contributing to acquired hydrocephalus in Uganda is
Okay.
infection. Baby acquires infection, or baby, for that matter, gets infection. A common infection that has been seen is meningitis, the inflammation of the meninges, or something that disturbs the tissues that protects the brain.
Okay.
And it progresses, and then it interferes with the flow of the fluids, which
Okay.
we talked about earlier.
Okay.
And this will now lead to accumulation of excess fluid within the brain.
Okay.
So infection.
Infection.
Two, there are those other conditions such as brain tumors, which are the tissues of the brain, or the cells of the brain tissues for that matter,
Okay.
start multiplying in a number that is not desirable and leading to compression of either the pathway or blocking it completely.
Okay.
In that case, surgeon has to look at it and see how can we correct it, how can we remove this tumor so that the flow of this fluid is restored to normal.
In simple terms, to remove an obstacle in the pathway.
Yeah, to remove an obstacle from the pathway. There could be an happening within the brain. For example, an injury. A child gets a head injury and bleeds within the brain,
Okay.
and this bleeding is not normal. And where the blood has bled and there's no circulation, there's bacteria is bound to grow there,
Okay.
because these tissues will respond and want to destroy it, and the way to dispose it of it may lead to formation of pus within the brain.
At that very point,
At
do
that-
you
yes.
want to tell us that every person who gets a head injury shouldn't take it for granted? We should run into scans, should run into to check out the brain and that.
Definitely, head injury is treated as an emergency issue,
Okay.
and has to be responded to with immediate effect.
Immediate effect.
Babies, to some extent, they're lucky because the skulls or the bones of the head are not yet fused,
Okay.
so their head can expand. But me and you, with already fused skulls, the pressure will be too much that if we are not supported immediately,
Okay.
we lose our
We
lives.
lose quickly.
Yeah, we lose. So
Okay.
brain injury is
Okay.
one of the gross causes of accumulation of excess fluid within the brain
The brain.
and leading to enlargement of
Okay.
the heads. Yeah.
Okay.
So there are so many factors, but some of these conditions are preventable mostly.
Preventable.
Talk about the infection.
Okay.
Yeah.
Wow, that's so nice. Our dear viewers, today we have a gentleman coming from Spina Bifida Hydrocephalus Association Uganda, and he's trying to throw more light. We first started with correcting the myth. Now we are here trying to look at the causes. What causes these illnesses, hydrocephalus and Spina Bifida? Yes, Mr. Gentleman, having looked at those things, what do you think are the symptoms? You know, we may be home. You talked of a wound on the spine. My child may present with a wound, and ideally it may be a secondary to birth trauma, and maybe it may not be coming directly from the spine.
Sure.
I may not have encountered a healthy worker or a medical officer or a clinical medical officer or anybody responsible for health. How can I, as a parent home, easily or quickly think that maybe my child will be having spina bifida and I need an intervention?
Sure. Yeah, thank you very much, Doctor. Let's start with spina bifida in that order.
Okay.
Because we are always talking about spina bifida and we get to hydrocephalus.
Hydrocephalus.
Yes.
True.
All right. Like I said, spina bifida is a birth defect, congenital birth defect,
True.
meaning the child will be born with it.
Okay.
And it presents in different forms. Let's start with the mildest form, that in most cases misses the naked eyes. It's hard to see it with our naked eyes, and in this case, it misses the eye of the midwife or the health workers who are attended to the mother at birth.
True.
Spina bifida occulta. This can be seen as a birthmark, spots along the backbones. Not just anywhere, a birthmark along the backbone.
Just a spot.
Just as a spot of either hyperpigmentation.
Okay.
The color around there of the color of the skin can be much deeper, and it can quite be seen that the color of the skin around there, it is different from the rest of the color of the skin on the body.
And you know what, on that point, Ugandans may not even take it serious as well. I used to play around with kids when I was young, and they could say, whenever you have a mark, that is your brother. Okay.
Well, depending on how people interpret it, like
Okay.
people have different ways of responding to certain things that they don't understand.
Okay.
But as a matter of fact, Spina Bifida can be seen in that form,
Okay.
or at this, that still mildest form could also be seen as a deposit of fat, or the skin around there is much more thicker,
Thicker.
and can be seen as a dimple along the backbone. It can occur at any point, right from the sacral or the tail until to the neck region.
Talking about
Yes.
dimpling is more of scientific, and
Yes.
people are aware of the dimples on their cheeks. Is it more like that?
It's more of a dimple on the cheek that people can easily see.
Okay.
That's why I'm saying this mildest form can be seen as one as a birthmark,
Okay.
hyperpigmentation.
Okay.
It can be seen as dimple, a deposit of fat
Okay.
along the backbone.
Okay.
It can be seen like there is a lot of hair, trough of hair, crowded on a particular point along the backbone of a newborn.
Okay.
In that case, you will need to consult a health worker who will recommend appropriate, imaging techniques
Okay.
to ascertain the structures of the tissues beneath that particular point.
Okay.
Spina bifida can also be seen in a form that can easily be seen as a swelling along the backbone. A swelling that can be tender, can be soft when you're touching,
Okay.
but the skin seems to have been covered by the skin, and it seems safe. Though other people tampered, like let's cut off this thing, it's not
and
normal.
see what is
Yes, and
inside
see what is
here.
that. Yes.
Okay.
It's another form of spina bifida that is more severe than the first form we talked about. Medical term may refer to it as meningocele, can be seen as a swelling along the backbone.
Okay.
The severest form can be seen as a swelling on the backbone
Okay.
with a very thin layer of skin
Okay.
that the water of the backbone are also being seen.
Okay.
Or can be like, it can rupture at any time, can break open.
Okay.
And we see that if this fluid is leaking.
Okay.
So this is myelomeningocele, which is very severe form of this birth defect, and has to be treated with utmost urgency to avoid further infection from crossing to the brain.
Talking about meningocele, and something was ringing in my head, spina bifida cystica, maybe that would be literature for another day. Maybe quickly, how do we tell that my child could be having hydrocephalus?
How to tell? It's easy with hydrocephalus because we can visibly see that the head is excessively big.
Okay.
The baby will be irritable,
Okay.
per se. It will be very irritable, crying with very sharp tone.
Okay.
The natural opening or the fontanelles on the head can be seen as swollen and tense.
Okay.
And we can see that the head is enlarging so rapidly, progressively becoming so large.
Okay.
And the child sometimes, fail to achieve the milestone.
Okay.
At a particular point where the child is supposed to now learn to sit, you see the child not able to sit, may delay learning to crawl, or in a more worst form, a child who has attained all this milestone may start regressing, losing the ability to sit, losing ability to eat. When a child is, for example, suckling breast milk, can be biting the teeth.
Okay.
These are the simple things that can be seen, and definitely a common thing that we can see is very high fever,
Okay.
and the child may as well present with convulsion.
Convulsions. Well, having looked at that, hydrocephalus specifically, maybe with spina bifida, you talked about an increase in the size of the head.
Yes.
And you tried to take us through the science. Well, how can we diagnose these infections besides using the history taking and observation? Is there any other parameters we can use to diagnose them?
Yes, depending now on the clinical assessment and the clinical decision the doctor is making.
Okay.
The cerebrospinal fluid may be tapped to analyze and see how is it. Is it normal fluid? Is
Okay.
it having blood? Is it having pus? The cerebrospinal fluid can be tapped.
Okay.
And this is a sterile procedure. It cannot be done from any health facility just like that.
Okay,
It needs to
okay.
be done with a lot of care.
Okay.
Yeah, but literally, where there is sterility is maintained,
Okay.
people, health worker can tap this, the doctor can tap this and analyze,
Okay.
and then be able to make a diagnosis and make a treatment plan.
All right. The way
Yes.
you're talking about spina bifida and hydrocephalus, someone out there viewing may be wondering, can spina bifida and hydrocephalus cure? If it does, what is the mode of treatment?
About the cure, let's start by talking about the time of intervention.
Okay.
Because like we know the disease progression, either you get a disease and you get healed completely,
Okay.
or you get healed with some defect, or you die.
Oh, you die.
Yes.
Is
So,
death a
first of all,
complication?
yes, death is a complication.
Okay.
And even disability is a complication. Meaning these conditions can be treated surgically. For spina bifida, surgically the closure of the back has to be done.
Okay.
Hydrocephalus, also surgical intervention, neurosurgical intervention will be done.
Okay.
And different forms of surgery will be performed depending on now the diagnosis,
Okay.
investigation which has been done.
Okay.
I've talked about the CSF analysis. They will do the CT scan to ascertain at what point in brain there is blockage. So the surgeon, the neurosurgeon in this case, will particularly decide on the type of surgery to be performed.
Okay.
Yeah.
Well, looking at that still, I'm more
Yes.
interested in knowing, well, someone just texted me here and said, what is the life expectancy of a person with hydrocephalus and a spina bifida?
Well, talking about life expectancy, we cannot miss talking about the quality of the life.
Okay.
The quality of life will determine your life expectancy. But let's complete the treatment.
Okay.
The surgery is a primary intervention.
Okay.
But what matters a lot now to determine whether this child will live longer or not is what do we do after the surgery. That is the rehabilitation intervention,
Okay.
which ideally has to be accessible by, I think, by protocol. All the referral hospitals in Uganda are supposed to be having a
Supposed.
functional rehabilitation unit
Okay.
to ensure the outcome of the surgery, you know, and to make contribution to improving the quality of life, which will now determine the life expectancy of this group of people.
Wow. Something is telling me that in Uganda here, we've been prioritizing more of the medical. After surgery, we are not so sure that this person is going to go into rehabilitation. Is it the case?
Literally, because surgery or immediate medical intervention is what people want to look at.
Okay.
And if you miss out the follow-up and the rehabilitation package of it,
Okay.
the quality of life of this person will be quite compromised,
Okay.
and so the life expectancy.
Well, okay.
Yeah.
Well, you talked about the treatment. People want to know outside there in Uganda, is there a specific place where we can get such care? I know it's not found in every health facility.
Yeah. Yeah, these are highly specialized form of treatments and surgeries which are accessible
Okay.
within neurosurgical facilities.
Okay.
Fortunately, with the advance and the development in the country, advance in medicine, I would say Ministry of Health has done a lot, government has done, but it's not yet to the expectation. Because there are only 2 public hospitals where we can access neurosurgery in Uganda.
Okay.
In Mulago and Bara Teaching Hospital. Only 2 public hospitals.
How about Chua Hospital? Have I heard
I would
about
say
that?
public hospital.
Public hospitals.
Only 2 public hospitals.
Okay.
And that one very fundamental, not for profit by the way,
Okay.
private but not for profit hospital, Chua Children's Hospital.
Okay.
They've done amazing job in
Wow.
brain surgeries,
Wow.
and they're still doing
Wow.
amazing job in brain surgeries. Now, that literally, we can then later talk about only 3 facilities.
Okay.
There are so many private facilities within Kampala doing neurosurgeries at exorbitant costs, which are not affordable by majority population.
But
And like I said earlier, this is a disease of the poor.
of the poor.
Indeed, you find very many, majority of the patients are very poor,
I know.
cannot access these services within in private facilities.
Okay.
And when we have only 3 hospitals in the entire country providing neurosurgery,
Okay.
where are we leaving the majority of the population? And where are these hospitals located? Well, and but that is maybe that's another topic for another day. A lot has been done. At least we have now 2 neurosurgical facilities doing amazing job. Mulago is doing by the exorbitantly amazing job.
Okay.
Equally, Bara Teaching Hospital is doing a lot in the neurosurgeries.
Okay.
But there's need for more. By the for your information, micronutrient still poses a very big threat to maternal and child health
I know.
globally.
I know.
And therefore, it's a call for everyone to take at least a part. From wherever you are, you have a role to play. Never think that it's only a neurosurgeon, because a neurosurgeon will also never work without a nurse.
Okay.
Thank you very much.
Well, you know, talking with intelligent people, you never want them to stop. But, you know, time and tide waits for no man. Well, it has been so nice having you for this show. And
my pleasure.
I believe a lot of people have learned quite much. Well, thank you, our dear viewers. And I say hydrocephalus and spina bifida is not only to the organization of SHAO. Like he said, it is a collaborative energy. It starts from the top to the bottom. Yes, let's eat well. You know, remember what you put into your body is what comes out. Well, catch up next time. Bye.